Welcome, ladies and gentlemen, boys and girls, dogs and cats, elephants and zebras, gypsies and the she. I know you don't want to see my chest, but I took my computer apart and redid my desk. So, anyway, it's really, between the two of us, we do our best to keep this place we do our best to keep this place in order, but it's hard. We both have our own health issues, and no, I'm not supposed to do a whole lot with this thing around my neck. So, it's uncomfortable to talk. Swallowing is just starting to get better. Hon, do you know how many weeks it's been now? 2 weeks today. Oh. 2 weeks today, folks. 2 weeks today. Okay, so what I'm going to do, for those who know, for those who know, I don't like to mention personal names anymore. For example, there's someone here in town who teaches gentle yoga. I would love to mention her, but the reason I would be to try and get people to go take her classes. But she hasn't given me permission to do so, and I'm not going to just say her name. And with that said, for example, my cousins, I'm not going to say their names. I have cousins all over the world. So, I am going to mention my surgeon's name. And there's a reason for it. One could argue that the doctor is a semi-public figure. I don't know if that's even a thing. The thing is, you could find him, and if you go to his to the website for Dartmouth Hitchcock. Okay, now Dartmouth Hitchcock has campuses all over New Hampshire, and I think at least one in Vermont. So ours in this area is Dartmouth Hitchcock Keene. I don't know the names of the others, but there's Dartmouth Hitchcock, which is in Lebanon, New Hampshire. My surgeon has been there for quite a while, actually. It was, I think, 90 or 91. And I'd say that's quite a while. I guess it is today. Anyway, so his name is Dr. Excuse me. His name is Dr. Abdu. And he's an excellent surgeon. His staff are excellent. Now, I will say this. The first couple of days after surgery, when I was at the hospital in Dartmouth, I don't really remember a whole lot. I don't really start remembering things until I went to the hospital at Mount Ascutney, which was a rehabilitation hospital. And now I have OT and PT coming into the house to, because, for example, let me show you this arm. Well, it's doing better now, but for a while I couldn't do that. I can do this, although it's difficult. I can do that. This arm is fine. My left leg. I can use my left leg again. Doctor, thank you. You know how many years it's been? how many pairs of shoes I've ruined because my foot would drag across the ground. As for my left arm, with continuing rehab, I should get it back. Now, the doctor, he was honest with me, and he told me that, I might not get some movement or whatever back just from this particular surgery, and it's possible that, it's still only been 2 weeks. It's possible that things can change, but so I still have 3.5 weeks of this thing right here, and I do not like that. This is the most aggravating thing I've had to live with in my life, and I've been through some things. And this I hate the most. Yeah, believe it or not, I'd rather go through the childhood abuse again than have to deal with this. No, actually, that's not true. But anyway, so he was honest with me, and not just that. It's his whole staff were honest and helpful. And one thing that I was told was that, it's probably going to be irritating my throat because the poking around and stuff. That had to be done. I don't think I can't pull the camera any closer, so I can't show you the stuff is on this side. It's not a really long incision, but, and let's see if I remember what Dr. Abdu told me. Again, I was on so much different medicine when I was coming out of anesthesia that it really, like I just don't remember things. And I may remember things in a way they didn't happen. So, for those who remember the movie Coma, I think there's a new movie called Coma, but I don't think it has anything to do with the original. I say original, I remember the 70s movie Coma. I don't know if there's been one before that. It was, what was Magnum PI's name again? Tom Selleck. That was his first movie, was Coma. He had 2 scenes. One, somewhere early on in the film, he's being examined and he's talking to the doctors. The second time you see him, they have him open up and they're harvesting organs. Anyway, in the movie Coma, the surgery takes place in OR8. OR8, and that's the OR I was in. But I'm here, I'm alive. See, what happened was my wife in there. I told her about it, and I made her watch the movie. I actually put toothpicks in her eyelids so she couldn't close her eyes. And no, I didn't actually do that to her. But no, it was OR8, and one of the doctors was like, "How did you know it was OR8?" I said, "I didn't know. I'm trying to be funny." And he's like, "Oh, okay." And I said, "You remember the movie Coma?" He said, "Yeah." Well, it was an OR8, and he's like, "Oh, okay." So, but no, they don't do that kind of stuff in Dartmouth. Dartmouth Hitchcock is the only teaching hospital in New Hampshire. So, look, in my book, if you are a doctor and you've been there a while, that says you're probably a darn good darn good doctor. Numero dos is that you, number one and number two, that you know how to be a teaching doctor. Because I don't think everybody is cut out for teaching. I have a cousin who would rather not teach, but he's still a smart guy. It's just not everybody is, wants to do that kind of thing. So, anyway, so Dr. Abdu, he was honest with me. He told me that I probably wouldn't get this, this movement back, but I have, which is really nice. I was optimistic, but I was also willing, to accept what the doctor said. And I cannot remember everybody's name involved with my surgery, so there are things I just can't tell you because I don't remember their names. They put the anesthesia in my hand, and this hand, or was it this hand? I don't remember which hand it was now. But I tell you what, anesthesia's come a long way. My mother was an RN. She started nursing in late 50s, early 60s. She used to tell me that back in the day, nurses were really not much more than glorified candy stripers. Well, that's not what they are today. There was a time nurses couldn't give medicine and stuff like that. Now they can. Now you have nurse practitioners who can make diagnoses and stuff, which is pretty far out in my book. But Dr. Abdu did a great job. Another thing I liked about Dr. Abdu and his staff is we got stuck, okay? Our regular tire, it just shredded. It didn't just lose air, it shredded. And then the spare, again, it shredded. So it took us hours and hours before we could actually get to the hospital. And I have a hard time with my hearing. I can't hear out of my right ear. So the problem with the left ear is if I hold a phone to it, if there's noise like there was on the highway, then I'm probably not going to understand a darn thing that anybody says. So I remember when I got my second hearing aid, I was walking down the street, and I walked by this tree many a time, and I stopped. I looked. Oh, there's a bird singing. He couldn't have been about a foot or two away from me. He was on the other side of the fence, but part of the fence hung over part of the tree hung over the fence, and that was really nice. But anyway, and I heard the bird every time I went by after that. But I haven't had a hearing aid in years. My first one I got from the state of Texas, where they paid for it, and my second one my aunties got for me. But they're expensive and don't have the money for one. But anyway, so I don't even know what I was saying. So getting some beard hair back. If I turn this off, I don't know. Can you see it? Yeah. So and then I went to Mount Ascutney Rehab Hospital. I was there, I guess, 4 or 5 days, and they were really nice. I really liked the folks there. Very helpful. They actually paid it. Both Dr. Abdu, his staff, and the staff at Mount Ascutney all paid attention to what was going on. I wasn't just wham bam, thank you ma'am, get out of my office kind of thing. It was so what's going on with you? And then there were questions and comments, and so they really tried to find out what was going on and how to work with it. Another nice thing about Mount Ascutney is that they have a annual annual picnic for rehab patients that come back once a year. they either already had it or gonna have it. Still haven't had it this year, but I'm not gonna go this year. I'm gonna wait. I've had enough of hospitals for a while, people. I mean, believe me, I've had enough of hospitals. Now, will there be further surgery? I sure hope not, but I do hope the doctor takes a look at my lower back. But I want to wait until I'm fully healed, and then maybe even a little longer than that before we do anything else. But if I were to give Dr. Abdu a rating, say 0 to 5, with 5 being the best, I'd give him a 5. His staff would get a 5. The hospital in general terms would get a 5. The Mount Ascutney Hospital would also get a 5. So, you know, that's pretty darn good. Now, let me tell you something. And I've had people ask me about this. In Texas, now mind you, I lived there for 40 very long years. And, you know, the folks up at Dartmouth and the folks over at Mount Ascutney, they're like, oh, San Antonio, oh, you probably got some really good health care down there. I'm like, no, I didn't. I got horrible care. San Antonio has this big old health science center, and I used to work there. I worked in human resources. Decent job, too. Good job. But, anyway, I didn't get care from them. I saw one doctor, and he worked for the county mental health program, and he said, oh, you probably had a stroke. And then another doctor who worked for a community mental health program said, oh, you have tardive dyskinesia. Now, neither one of them asked me a single question. I never had an MRI, I never had an X-ray, I never had a CAT scan, I never had nothing. They just said, well, this is what it is, without doing any exam. And, you know, looking back on it, I realized when this first started, and it was after the fire, when I had moved into that horrible apartment complex on Fredericksburg Road in Balcones Heights. I don't even remember the name of the place now. But anyway, I didn't have any. I lost everything in the fire, so I had a sleeping bag that I was sleeping in that somebody gave me, and I think that's when this happened. You know, I was laying on the floor, and all of a sudden my body just started doing weird things. But anyway, so that would have been 2009, 2010. It would have been 2009. That's when the fire was, so it would have been that year. But, you know, up here, I've got nothing but the best health care one could imagine. My wife, even though she, sadly she didn't survive the cancer, nonetheless she got some good health care up here. So, anyway, so that's all I really wanted to say. I just want to make sure everybody knows that things are going okay here. Oh, this thing right here is aggravating. I also want to make sure everybody knows I had a great doctor, and he has a great staff, and that's about all I have to say. Have a good evening. Bye.